October is Breast Cancer Awareness Month, and unfortunately, 1 in 3 at risk cancer patients develop lymphedema as a result of their treatment. But the Blessing Breast Center is offering a new option that can help detect lymphedema in its earliest stages. I'm Laura Wheatholder. I'm a registered nurse and community outreach coordinator for Blessing Health System. I'm joined today by Jessica Nuebel, nurse navigator with the Blessing Breast Center. Jessica, thanks for joining me. Can you take a moment to introduce yourself?
Yes, my name's Jessica Nuebel. I'm a registered nurse here at Blessing in the Breast Center. I've been with the health system for almost 20 years, and I've been in this role for about the last year and a half.
Well, Jessica, thank you so much. Now, let's start with some basic information. What is lymphedema and how is it linked to cancer or cancer treatments?
So lymphedema is an accumulation of fluid in one of the limbs of your body, or it can be in your center, your trunk. Um, it relates to breast cancer when certain treatments interrupt the drainage of lymphatic fluid from your arm on the side of the breast cancer. So the screening that we are utilizing will help us detect that very early so that we can initiate treatment as needed.
And as you said, it's not just linked to breast cancer, it can be related to other cancer treatments. But I understand lymphedema develops in stages. So, what might a person who is developing lymphedema notice or experience?
So you were correct. Lymphedema, there are 4 stages, and the first stage is subclinical, where the lymphedema has started, but the patient may not have any signs or symptoms, and that's where we're hoping to detect it with this new screening tool. But if a patient starts to have signs and symptoms, that would be heaviness or fullness, feeling in the arm, swelling, where the shirt sleeve fits more snug than usual, or your jewelry is a little more snug. It could be associated to some discomfort in that arm as well.
Now, the Blessing Breast Center is introducing this new testing technology, as we kind of alluded to earlier, and it can help diagnose lymphedema. Can you tell us about this new testing device?
Yes. So the piece of equipment is called SOZO, and it looks just like a standing scale. Patients will come in, remove their shoes and socks, stand on the equipment, place their hands on a platform, and it takes about 30 seconds. And the equipment measures the fluid volume in the limb that we identify to the equipment. So we're planning to do this on a regular basis, definitely before treatment starts, and then every few months after surgery or radiation, whichever happens first. And we have a whole screening schedule outlined for patients to follow.
And so the new SOZO technology can help detect lymphedema potentially before someone even notices symptoms. Is that correct?
Yes, absolutely. So the goal is to detect it in its earliest stage, because in that stage, stage 0, there are therapies we can offer that will stop the progression and possibly reverse it. If the lymphedema is not detected until later stages, the goal would be to stop the progression, but it may not be able to be reversed.
And now you talked briefly earlier about how the SOZA test is conducted. You said it's a lot like a standing scale. Is there anything special that a patient would need to do before coming in for their appointment? Or, what should they expect once they arrive?
Right, that's a great question, Laura. There are no special instructions for before the testing. Like I said, patients will have to remove their shoes and socks when they come in before the test. Other than that, we'll have them empty their pockets, no metal in their pockets, and we'll have them take their jewelry off their hands. There are a couple reasons we wouldn't do it, and that is, one is if a patient has a pacemaker. So that's something we would need to know ahead of time. But other than that, we can do the testing on anyone, and there's no special instructions ahead of time. Again, the test only takes about 30 seconds, so it's quick, and hopefully is not an inconvenience to the patient.
Well, Jessica, is there anything else you would like to add today about the SOZA lymphedema testing device or how it might benefit breast cancer or others receiving cancer treatment?
So, breast cancer is not the only type of cancer that carries a risk of lymphedema. Most cancer treatments can carry that risk as well. So, that is definitely something I urge patients to talk to their healthcare provider about. If you've got a history of breast cancer and this is a service that you're interested in, again, talk to your healthcare provider, or you can call the breast center and we can provide more information as well.
Great. Jessica, thank you so much for taking time to talk with us today. And you can find more information on breast health, lymphedema, and the SOZA device on our website, blessinghealth.org/breast center. Thank you again for joining me.
Thank you.